Hello, my name is Katja Weisel. I'm from the University Medical Center of Hamburg-Eppendorf in Hamburg, Germany. And in behalf of my co-authors, I presented at this year's EHA the matching adjusted indirect comparison of Ciltacabtagene Autoleucel versus Belantamab Mafodotin in patients with relapsed and refractory multiple myeloma being triple class exposed. So Ciltacabtagene Autoleucel is the new CAR T-cell agent, which is investigated in several clinical trials. And the pivotal trial, the CARTITUDE-1 trial, where an update is presented at the EHA, was a single-arm trial, so that direct comparisons between cilta-cel, how we call it, and other standard of care treatments are missing. So one of those novel agents being recently approved and is also directed against BCMA is Belantamab Mafodotin, an immunoconjugate. And in the absence of a common comparator, we used a so-called unanchored matching adjusted indirect treatment comparison to estimate the relative treatment effect of cilta-cel versus Belantamab Mafodotin. And coming to the results, we saw that cilta-cel demonstrated a significant improvement in overall response rate and complete remission rates compared to Belantamab Mafodotin. And this meant, for example, for overall response rate that we had with the CAR T agent an overall response rate of 97.9%, and this was compared to 30.9% for Belantamab Mafodotin. And we also looked for survival outcomes, and the same. We could see that the median PFS was 22.8 months for cilta-cel in this analysis compared to 2.9 months for Belantamab Mafodotin. And there was also a marked and significant overall survival benefit. So to summarize this, all conducted analysis in this investigation showed consistent and robust results for the efficacy endpoints, response, and survival that were all in favor for Ciltacabtagene Autoleucel versus Belantamab Mafodotin. And what does that mean for patients in the daily clinical routine? I think we are clearly facing now the upcoming CAR T-cell treatments in multiple myeloma, and in the US, the first CAR T agent was approved in March 2021. This was Ciltacabtagene Autoleucel. So with Ciltacabtagene Autoleucel, we have a CAR T agent which showed really unprecedented results in heavily pretreated patients. And with this comparison, we underline those results and the importance. And so I personally think that this is a clear sign that we all should work together to bring the CAR T constructs in a safe and fast and broad manner to all myeloma patients at need.